Most people assume that in a medical emergency, help is just a phone call away. But what if hospitals are overwhelmed, supply chains break down, or doctors simply aren't available? When disaster strikes, you need to be your own first line of defense. Doctors who have witnessed these crises firsthand have identified the exact medicines to stockpile and the DIY procedures that can save lives when no one else is coming. In major disasters, hospitals become overcrowded, medications run out, and life-threatening conditions are left untreated. As doctors who have worked in crisis zones have identified the most critical medicines and survival procedures every household should know. Being prepared isn't about fear. It's about taking control and ensuring your family's survival when systems fail. Most people assume modern medicine will always be available. But what if I told you that in a real crisis, even doctors can't get the care they need? During major disasters, hospitals turn people away, life-saving medicines disappear, and survival depends on what you already have at home. Dr. Michael Carter had seen it all. Gunshot wounds, car accidents, heart attacks, but nothing prepared him for what he witnessed during a national blackout. It started as a simple grid failure, but within 48 hours, hospitals were overrun. The ER hallways became a sea of people. Elderly patients needing oxygen, diabetics in crisis, parents clutching feverish children. Medications ran out fast. Ventilators shut down. Nurses wept as they turned people away. Then, the looting started. Pharmacies were stripped bare. Desperate people searched for insulin, antibiotics, even basic painkillers. Dr. Carter watched helplessly as preventable deaths stacked up. A young girl with an infected wound, something easily treatable with antibiotics, slipped into septic shock and died. A man having a heart attack was left gasping on a waiting room floor because there was no medication left to save him. That was the moment Dr. Carter realized the truth. Most people don't stand a chance in a major crisis. After the blackout, he and a team of survival-focused doctors made it their mission to prepare people for medical emergencies when help isn't coming. They compiled a life-saving list of essential medicines, antibiotics, pain relievers, emergency heart medications, and simple DIY procedures that could mean the difference between life and death. Here's what they found: stockpiling critical medications. There are 5 essential types of medication every household should have, including antibiotics, antihistamines, and emergency pain relievers. In a crisis, these are often the first to disappear. DIY medical procedures, from closing a deep wound to making a temporary splint, knowing basic emergency care can save a life when no doctor is available. Knowing when to act versus wait. In a survival situation, knowing what to treat at home and when to seek help can mean the difference between life and death. Many people die simply because they panic and don't act in time. Dr. Carter realized that medical preparedness isn't about doomsday prepping. It's about being ready for the inevitable gaps in modern healthcare. The truth is, medical emergencies don't wait for the right conditions. When disaster strikes, your survival depends on what you already have and what you already know. Being prepared means not becoming another statistic. It means protecting yourself, your family, and your community. Yes. Doctors who have lived through crisis situations have already done the work for you. They've identified the exact medicines to stockpile and the medical procedures every household should know. Don't wait until it's too late. Click below to get your essential medical survival guide now. Remember to like, subscribe, and share.